I was just like, how can I help? And they had like really bad burns all up on their legs. And then I went over to this other grass area that was like right by the front entrance. And there were some people, there was another lady on the ground with really bad burns on her legs, just like screaming.
A witness to yesterday's anti-Semitic violence in Colorado describing the scene. The suspect in this attack allegedly used a makeshift flamethrower and threw Molotov cocktails at the group. 8 victims suffered significant burns, with at least one in critical condition this morning. For more on these injuries, I want to bring in MSNBC medical contributor Dr. Vin Gupta. Dr. Gupta, the victims range from age 52 to 88 years old. You heard that witness. What do you think these injuries could look like?
Well, Anna, it's an incredibly difficult situation. Usually, what ends up happening in situations like this is severe burns, and it sounds like there's a few severe burns here. People prompted to have to go to a specialized burn center in Denver. These can be life-threatening, and typically what happens, and I think we might have a graphic for your viewers just to contextualize this, because this is relevant to every family, because we all have things that can cause fires in our homes. First-degree burns typically tend to be just something that causes redness on the skin, and some pain. But then as you get deeper and as the nature of the burn gets more pronounced, it can really burn all the layers of the skin, all the way up to the muscle and the bone, not to get graphic. But then that's when that specialized burn center really kicks in, and we talk about supportive care, making sure that if they need a ventilator because they may have burned their airway, that's something that we keep in mind. Usually what ends up happening, though, Anna, is really fluid management. People that have severe burns, in this case, at least a few of them sounds like they've had severe burns. They lose a lot of fluid, their blood pressure gets low. So that is key, is fluid management, and then preventing complications like infections, malnutrition. But generally speaking, once we get to that stage, and again, at least a few folks seem like they're in this condition, it's usually months of recovery.
Wow. What can anyone do in a situation like this to try to help a victim who has suffered a burn just in the immediate moments after an incident? What kind of medical attention is needed right away?
So right away, if you're, so a few things. If you've been exposed to a fire, the first things first is you want to make sure, sometimes it's not obvious, Anna, is their major airway, their windpipe, might have actually been burned because of smoke inhalation. And so look near their nostrils and see if there's any signs of facial burns, if they have singed nasal hairs that might suggest that, oh gosh, they might actually have impending swelling of their windpipe and it could close off. That actually can be a big unrecognized killer. Do they sound like they're having stridor? They're in difficulty actually getting any words out, or it's high-pitched noises if they're trying to speak. That's a medical emergency, an immediate medical emergency. They might need something called a crike for short, which is essentially inserting an airway directly into what is basically their throat. But that's something that needs to get immediate attention. Do they need to be put on a mechanical ventilator? So that's number one. Number two is, and typically for the EMTs out there, airway, breathing, circulation. Are they breathing? Do they have a patent airway? And then can you feel pulse ultimately? And so that's, again, fluid management, low blood pressure is the second concern. But that first initial concern, anytime you're near a fire, and you're worried about a victim, is exposure. And is there potentially damage to their airway that you can't actually see?
Dr. Vin Gupta, as always, we so appreciate your expertise. Thanks for sharing it with us. Coming up, new COVID questions as a vaccine gets limited approval amid a major shift under RFK Jr.'s leadership. We'll have the details. And desperate Palestinians wade through a war zone to find aid and food in Gaza, only to be met with more violence and death. What we know about the latest chaos at one of those controversial distribution sites.